Thank you very much, Mr. Speaker. I rise to support the gentlelady from Clarion County's legislation, House Bill 818. I believe there is some confusion about the effect of this bill, and notwithstanding the pronouncements of the prior speakers, I do respectfully disagree with their remarks. This bill, House Bill 818, does not change current law as to a woman's choice to have an abortion under 3 exceptions of the Abortion Control Act. It maintains that law as it currently applies. Under the Abortion Control Act, Title 18 limits the use of public funds for an abortion except when the life of the mother is at stake, when the pregnancy was caused by a rape, and when pregnancy was caused by incest. Prior to the Affordable Care Act, Pennsylvania limited the use of public funds in CHIP, Pennsylvania Fair Share, Medicaid, and those programs are funded to some degree by public funds. Medicaid, public-private share is 100%. In the case of Fair Share, substantially less. The policy, however, is uniform across the board. No public funds support elective abortions. Elective abortions on demand. The bill simply extends the same policy to the Affordable Care Act health insurance exchange. Every plan offered through the exchange benefits in some way from public funding. That is the purpose of the Affordable Care Act. Therefore, in order to be consistent across all publicly subsidized insurance platforms, the bill is necessary. It simply maintains the status quo and treats everyone equally. House Bill 818 would allow the Commonwealth to opt out of abortion coverage in the federally facilitated health insurance exchange. Opting out of covering abortions in exchange is specifically authorized under the Patient Protection and Affordability Care Act, the federal health care reform plan. In fact, President Barack Obama's executive order signed a couple of years ago allows specifically the states to elect or opt out of this insurance exchange abortion funding option. PPACA specifically permits states to prohibit insurance providers that participate in exchange from covering elective abortions. To assure that elective abortion is not included in the health insurance exchange, the Commonwealth must affirmatively opt out by passing a state law. And in fact, many other states have done this already. House Bill 818 will clearly prohibit taxpayer-subsidized insurance from covering elective abortions and merely puts the newly created health exchange in line with long-standing policies in this Commonwealth that have been supported by Democrat governors as well as Republican governors. Only elective abortions are excluded in House Bill 818. The bill does not eliminate coverage of abortions in the cases of rape, incest, or the life of the mother. House Bill 818 will not change a Pennsylvania woman's access to abortion. Currently, no tax dollars are used for elective abortions in Pennsylvania. We want to keep it that way. We want to keep it consistent with all the laws and policies that we have had for decades here in Pennsylvania. Abortion coverage has long been prohibited in Pennsylvania's Medicaid program, except, again, in cases of rape, incest, or the life of the mother. House Bill 818 would guarantee that taxpayer-supported plans in Pennsylvania's health insurance exchange, when created, are in line with this long-standing policy. Once again, this bill, House Bill 818, we passed actually last session with bipartisan support. It has not changed. We passed similar language during the session with a vote of 146 to 45. This is not a different bill. This is the same language of last session. In its current form, the bill limits the use of federal and state funds to pay for abortion services to those exceptions which are included in the Pennsylvania Abortion Control Act. Again, those exceptions are for rape, incest, and to avert the death of a mother. These exceptions, again, are contained within Title 18 of our Abortion Control Act. Once again, President Barack Obama's executive order, which he signed in 2010 in March, limits the use of federal funds, also mirrors the language in 818, in that it prohibits the use of public funds except in the case of rape, incest, or protect the life of the mother. Additionally, in Title 18, Section 3215E does not address insurance policies and requires that every insurer offer policies which expressly excludes coverage of abortion services, but for in cases of rape, incest, or the life of the mother. While some point to this provision as to why House Bill 818 is not necessary, it is important to note that the only insurance policies we are referring to in House Bill 818 are in the insurance exchange. The federally facilitated insurance exchange will be created by the federal government using tax dollars. The insurance plans offered in exchange will in almost every case be subsidized by tax credits or paid by tax funds. Anyone below 400% of the federal poverty level is eligible for subsidies through that exchange. And the administrative costs will also be shouldered predominantly by the Commonwealth. I just want to conclude by saying House Bill 818 is consistent with the Hyde Amendment that was passed in Congress in 1976. It's consistent with the Abortion Control Act of Pennsylvania. It's consistent with President Barack Obama's Executive Order number 13535, signed and dated March 24, 2010. It's consistent with the polling that I've seen, depending on the poll, between 60 and 70% of Americans oppose using taxpayer dollars to fund elective abortions. And finally, this bill is consistent with what we have passed in the last session with a strong bipartisan vote of 146 to 45 on December 12, 2011. Mr. Speaker, I proudly stand in support of the gentlelady from Clarion County's legislation and ask for an affirmative vote. Thank you, Mr. Speaker.